Hi everyone, good morning, or good afternoon, or good evening. I'm J3, your host for the second episode of I Am Patient's Ask a Doctor series. The topic for this month is Mind Matters. I'm actually very excited for this topic because psychology is something very close to my heart, and I think it's relevant, especially now that a lot of people are experiencing mental health issues due to the pandemic. With us today is Dr. Karina Fernandez, or for some of you, maybe Cara Fernandez, a renowned clinical psychologist with 20 plus years of experience. She is also the director of Ateneo Bulatao Center for Psychology Services. When she doesn't have her counselor hat on, she also teaches as a professor in the Ateneo de Manila University. I'm proud to say I've actually had the privilege of being one of her former students. So I've seen how skilled she is when it comes to mental health. Welcome, Dr. Fernandez. Thank you so much for joining us today.
Thank you for having me, JR, and thank you to hello to everyone watching.
All right. Okay. I believe the demand for mental health support and services has significantly increased over the last year due to the current situation, not only in the Philippines, but globally as well. Many of our followers are actually curious to know whether or not they should see a doctor for their psychological well being. To start us off, what would you say are common warning signs or symptoms of mental illness that people need to watch out for?
Okay, so first of all, thank you for this opportunity to get the word out about the importance of mental health in general, and especially in this current context that we are in, no? This period of vulnerability and uncertainty. Okay, so many people do want to know, how do I know if this is already something I have to look into? If I'm already at that level of psychological disease na I have to seek professional help. So here are a few guidelines, no? So one of them is just simply the psychological distress that you really feel um, emotionally um, problematic, whether it's anxious, stressed, overwhelmed, sad, a lot of the time, okay, let's say in a day, more than not in a day, and more than not in a week, and more than not in a month. Okay. Given the pandemic, we are all being emotionally challenged already. Okay. So what is the norm compared to pre-pandemic is different because we're all stressed now because of the vulnerability and uncertainty of
Right.
the everyday. Am I gonna get sick, or are my loved ones gonna get sick? And also the vulnerability and uncertainty moving forward. When will this end? You know, people are afraid of many things, but at least they know by tomorrow it will end, or by the end of the year this will end. But because we don't have that, that adds to our emotional vulnerability. So it's so we all feel overwhelmed. But if you feel it's already taking more time in your life, that's one consideration. Uh, a second consideration is functionality. That you feel you're already not functioning at the level you used to in terms of whatever task that your developmental stage requires of you. Meaning, for those who are in school, or for those who have children in the school setting, if they are really significantly not performing, submitting their assessments as they did, you know, they did not have that same level of productivity that they
Right.
had before, then maybe that's something to look into. For somebody, of course, in the work world, if all of a sudden they're not able to submit the paperwork they have to submit, work on the projects they have to work on, make the presentations that they have to prepare. No, if parang they can't function at the level they used to function in the tasks that developmentally they are assigned to perform, we have to watch out for that. Okay, that's another warning sign. But again, our standards are a little lower
Right.
because
Right.
again, we just feel our psychological resources are just lower. Everybody. So let's go back. Everybody's standards will go down. And if you're still
Mm-hmm.
lower than that, that's another thing to look into. No? And then third, so that's productivity, work, achievement. And then just
Correct.
in terms of your day-to-day practices. Okay, of course we can go to the mall, we can go watch movies, we can see friends, but
Mm-hmm.
somehow, um, even with those limitations, we are able to continue to do things that we used to enjoy in a creative way. Let's say your Zoom,
Yeah.
your inuman, right? Your inuman with your friends, or your Saturday evening hangout with the girls, things like that. Or you're doing a watch party, di ba? A lot of people are doing that. So you somehow still have these things that you enjoy, watching just a certain telenovelas, di ba? Or you found out on Netflix that there's this new horror movie that comes out and you're the first one. Oh, let's watch that new one. So
Yeah.
those interests, somehow we're still able to find them and engage in them. But if those interests, para sudden loss of interest in those things that used to bring you joy, na parang wala nang gana. Or food, or just food, because now, di ba? Now I think people are a little ano na about, getting food that they like. Pizza, biglang pizza night is every other night na, di ba? And
Right.
that's
Right.
understandable because nga, we want to somehow get some fun out of life pa rin.
Mm-hmm.
But all of a sudden, pizza that you used to love and enjoy, parang now, I'm good. You eat one slice, pilit pa. So things like that. When that also changes or is significantly different, or kung isang beses lang nangyari or a couple of times, that's fine. But if it seems to happen with more regularity and more intensity, yeah, then that's another signal that maybe you have to see someone. But again, please know that to see someone does not, mean anything. I guess like anything, you see a rash on your arm, you have it checked. It may be something, it may not be something. But again, with those signposts, you or your loved one, you might want to just have it checked out. The earlier we catch psychological issues, the better.
Right. Okay. Yeah, so you discussed actually several points, mainly your emotional distress, your functionality, and your loss of interest as well. And I think the common thread with the points that you mentioned was that there's a certain comparison from your previous self, or at least who you were before this pandemic, and then in comparison to who you are now, how you're behaving, I guess also how you're treating yourself. Is that right?
And how you treat others, right?
Right. Okay.
For
Yeah.
example,
Yeah.
part of that emotional distress kasi, maybe I should have on that, expounded on that. It might be internal nga, like you're all of a sudden always sad, overwhelmed,
Mm-hmm.
in your room, quiet. But it can also be in externalizing. You're
I
more,
see. I see.
yeah, diba? You're more irritable, more easily frustrated with others. You snap at others for things that you never used to snap about, no? Or madali ka mainis, mabilis kang sumigaw. It can also be like that. I'm not saying it's both, but different temperaments will mean different ways of presenting that internal emotional experience. It can stay emotional or it can be externalized.
Okay, understood. And with that, so let's say, for example, I'm someone who has related quite a bit with everything that you mentioned. I've noticed that there's a significant change in mood with myself for the past few weeks or months. Um, Maybe it's not apparent for some, but there are actually a lot of mental health specialists that patients can choose from. We have what are called psychologists. There are also psychiatrists, psychometricians, psychological social workers, guidance counselors, you see them often in school, and other professions related to the general field of psychology. How do you know what kind of professional to see?
Well, we always suggest start with one. I, of course, as a psychologist, will say start with a psychologist
Mm-hmm.
uh, to get the depth and breadth of the problem. And then it's very possible that the psychologist will say, okay, you can work with me. Or maybe the psychologist will say, I would like that you also get pharmacological interventions so that I can work with you well or I can work with you effectively. So you start with one, and then we usually work in teams. Um,
Right.
One will say, okay, I think while you're having your medical support, it would also be good to um, arm yourselves with the psychological tools to be able to cope better, to be able to think in a different way, to be able to help yourself when you're starting to feel emotionally overwhelmed. So, yeah.
All right. Okay. And it is true. I think it was Lao Tzu who mentioned before. The journey of 1,000 miles begins with a single step, and I guess the journey to better psychological well-being also takes that first step. Just that first consultation. Maybe not so much even with a psychological social worker or a specialist, but even just a friend, and then expanding from there. Yeah. Right. And I think, a lot of people are also curious about this next question. There are many myths, actually, and I'm sure you would know, regarding psychology that has confused the general public for a long time now. Some insist on preaching from their armchair psychology background. So, how does one acquire a mental illness? And for some, they would also ask, is it something that's hereditary?
Oh, okay. So there's the biological model. They say it is genetic, that for example the probability of having clinical depression is higher if you have a family member who was diagnosed with clinical depression, and therefore we attribute that genetically. Relatedly, staying with the biological model, it can be about hormonal imbalances. So a very physiological framework. Another one it can be about your history, things that happened to you, maybe a trauma in childhood or a certain kind of extreme environment, one way or another. Um, Maybe hostile parenting, for example, or inconsistent care, uh, have been found to affect a person's the development of the person's psychological resources to be able to cope with everyday challenges as well as bigger challenges. No, so that's more the social model. um, the social sort of like we call that the psychodynamic model, but it has a social component because your environment affects who you are. um, you can also have it, maybe it has nothing to do with your past, it has nothing to do with your genetic makeup, but maybe something that in the present, uh, the expectations of you and what you are capable of uh, doing are not a match. Talaga, you're just so overwhelmed. Um, there's just too much being asked of you. Or the worst case scenario, there's a present traumatic experience that has made you more vulnerable, has really challenged your psychological system to be able to be resilient in whatever adverse conditions you are faced. So yeah, so you have the biological model, the social model. Okay, there's also like the learning model. You remember that? Maybe you learned that in school.
Yeah.
That there's that learning perspective that maybe a
Mhm.
person had a bad experience before, and therefore relate they always think that when I have a similar, let's say you had a very terrible boss before, and now you have a new boss, and simply because that person is labeled boss, you already automatically assume that this is going to be a difficult experience. Okay. And then, so that's the learning, the kind of stimulus response model. But there's also the cognitive model that some people have mental health issues because of how they think about things. They have what is called cognitive distortion. So, for example, they think always in extreme ways. I have to be perfect in my output, whether it's a student and her quizzes, or an employee and the financial report they have to make, kailangan perfect. Na hindi makatulog. Kahit gawa na, okay na siya. Pero hindi, binabalikan mo, hindi ka makatulog the whole night, iniisip mo all the time, nasa stress ka. So that's called black and white thinking. I am perfect or I'm lousy. So yeah, so there. That might be another reason why a person has mental health issues. The way they think and the way they perceive information or interpret information.
All right. Okay. So there are actually a lot of models, a lot of approaches to see how psychology can affect your mental well-being right now. The one you mentioned earlier with the learning, I think that's quite related to association and our mental maps from our previous class before. Yeah. So I definitely could remember that, and it's quite relatable also. So we've been in lockdown for roughly 9 months now. And we know that, of course, continued stress and anxiety can pose long-term effects on our mental health. With the lockdown going on and a lot of us isolated from our friends and family due to social distancing, do you have any advice on how our viewers can take care of their mental health?
I have plenty advice. We can take an hour. Okay. Several advice. First of all, take care of your physical care, physically, because we know that our biology affects our psychological well-being as well. And what does that mean? First, really get adequate rest. You know, make sure you get a good amount of sleep, because the physical storing of energy will help you psychologically, because it makes you more capable of managing your emotions throughout the day. So with the physical, you have sleep, you have healthy eating, you have exercise. Um, and then moving from there, have a routine. So maybe decide in a day how many you spend this many hours working, or be productive, then I'll take a break. So honor your breaks, and then I'll go back to work, and then I'll have lunch, then I'll work for an hour and a half, then take another break. So really have a routine, and this routine be made up of both work, because we all have to work, whatever that means, student, employee, but also really giving time to self-care, and have those moments to really step out of the work environment. The thing is, we can't go home na, diba? Before we go to office, and really just
We're
getting
already home.
that door, diba? That front gate door of our building, and we're finished na my work day, and
Yeah.
home, right? But there's no more like that. Okay, so that has to be the way to deal with that. The best we can right now is simply to honor your breaks, to really take the time and, what do you call it, step away
Mhm.
from that table, mentally step away. Maybe now you stepped away and went to your kitchen, but you're still thinking about it. um,
Okay. Yeah.
Really, really switching off every so often.
Mhm.
And then, of course, find your personal coping strategies. Of course, I believe in social connection, talking to people, uh, and even in this talking, there are different kinds of talking. The talking where that's very heart to heart, you'll have those friends where there's really that level of intimacy where you can really pour out your emotional pains.
Right.
But you also need other kinds of social connections, such as just the chica. You'll just be talking about
Yeah.
the
Yeah.
latest, di ba?
Mhm.
Korean novella that you watched. So we need that variety, okay? Because our whole psyche needs that. Really emotional support as well as what we call the companionship support. Yan na yung mga video watching party kind of relationships. Wag lahat mabigat, wag lahat mababaw,
Yeah.
companionship. So social connection and other coping strategies. Different people do different things. Prayer is a very big resiliency strategy for Filipinos. Hobbies also,
Yeah.
because
Yeah.
the moment where the point is not the goal but the activity itself, right? So we hear all these terms like plantitos and plantitas,
Yeah.
friends. Tama ba yan? For
Yeah. Yeah. Yeah.
these things, people,
Mhm.
of course, baking and cooking. Everybody now is a chef,
Oh
or
yeah.
and that's fine because you are again shifting your attention from work,
Mhm.
but and at the same time bringing in creative energies and also bringing and just having fun, all of which helps us build our resiliency, our psychological resiliency, to cope with our present times. So all of that, and then a lot more, of course. I'm a mindfulness practitioner. The Bulatao Center is the first center to bring in mindfulness-based cognitive therapy in the Philippines. Um, so mindfulness practices are also very, very helpful, which studies on mindfulness have shown to help with stress reduction, depression, anxiety. So yeah, maybe looking for all of those YouTube or apps that teach you to do mindfulness activities. So inviting all of you to start a mindfulness practice as well, and that has helped me a lot also personally throughout the pandemic.
Right. Okay. And I think most of your publications have also revolved around mindfulness. You've had a lot of seminars in the past regarding that. So yeah, that actually counts for one of the coping strategies you could use. For our viewers watching right now, just to recap some of the other points that Doc Cara mentioned, take care, of course, of your physical health. Your body is just as important as your mind. Have a routine. We are right now currently, at home, or at least we're situated somewhere where it's quite hard for us to, mobilize and go somewhere else as well. Honor your breaks. That's quite important, especially for those who are working and for those who are studying as well during this time. And of course, not just, being alone, but also having those social connections that we can tap in. All right. And it was getting published quite often, especially during the middle portion of this pandemic, that there's supposedly going to be a second wave after COVID-19. And that would be the second wave relating to our own mental health. So aside from, you know, um, our psychological well-being, many of our viewers are also curious to know how they can help friends who self-harm or are having suicidal thoughts because it's becoming quite an apparent issue as well. So what's the best way to support friends and family members who suffer from a mental illness?
Um, One thing we have noticed in the Bulatao Center is really the rise of cases, of mental health issues. We have more clients now, even if we're online. Um, we have more people coming in,
Mhm.
young people, older people, children. Okay, and one thing we tell their loved ones, when we do the um, feedbacks with the family members, And funny how many of them it comes like a surprise or something that they have to remind themselves. And that is empathic listening. Empathic listening means honoring and validating and respecting whatever it is the client, the patient, says, thinks, feels, and experiences. We do not minimize their thoughts and feelings. We do not set it aside and say, yun na yun, or yun lang, or magpasalamat ka nga, ang may iba dyan na walang bahay ngayon, di ba? Or mas naghihirap, at least ikaw may trabaho or yung tatay mo may trabaho. Or ikaw nga pag nag-aaral naka-aircon, yung mga ganyan. And when they, things like that. So minimizing that person's experience, what that does is it shuts down that person, and the communication, the support that we that everybody needs right now is lost. I use this whenever I do workshops and empathic listening. I bring a beach ball and I throw it. I ask somebody from the audience to come up, and I say, if you say, so I say, throw me the ball, and then I say, if you say, if I'm the client and you say to me, yun, that's it, that's your problem, pasalamat ka na nga. I'm like holding the beach ball, I'm not gonna give it back. So the back and forth communication, which is essential for mental health, is lost. So what is empathic listening? It's trying to really understand the point of view of the other and communicate that understanding. It does not mean you agree with them. It does not mean you will take steps to, do what they want. But simply saying, I get it. I get what you're trying to say. And I really see that you're feeling, anxious these days or overwhelmed. When a person feels understood, that is the first step to wellness. That they feel, di ba, ito yung classic sa mga movies, I see you, really, di ba? Or parang, when we ask clients what they like about our work with them, they said, finally I found somebody who listened. And listening here is not just hearing. The way you hear a song on the radio while you're chopping tomatoes. This is really taking it in and then giving it back and saying and really trying to understand. So I understand that, let's say you're talking to a teenager, you really feel your teachers are being unfair now with all the requirements they give, and it's really tiring you out. Rather than, pasalamat ka nga, nag-aaral ka, or something like that. Or wala ka namang ginagawa buong araw di ba? But, like many students are feeling, are really lost and having a hard time navigating their way, because between online and then what assessments are now, what does quiz look like now, and what to expect, everybody feels lost, and therefore to be heard, it sounds like you feel lost, and it's hard to know what teacher wants. To be heard is really so important, because the person feels a certain sense of worth, a certain sense of being validated. That really goes a long way in terms of mental health, feeling better, feeling that they can cope. So empathy.
Right. Okay. And I think it's really that acknowledgement, that listening, that can really help you. Especially during our situation right now. Just having someone who you can unload your thoughts with is quite important. Whether this would be your parent, a professional such as yourself, maybe even just a friend. And I think for most psychologists, they often say, or at least some of them say, the goal is really for us to become less relevant, because that would mean as well that the need for mental health services would also decrease, and therefore suggesting that people are actually taking care, or at least they're having an easier time to handle the struggle. All right.
Yeah.
So thank you very much, Dr. Fernandez, for your generous time today. We really appreciate you sharing your tips and answering a few questions from our viewers. Before we conclude, maybe you'd have any final words or maybe a final message about our psychological well-being for our viewers.
I think my final message would be uh, for everybody to take it easy on themselves. That, it's okay to not do as well right now. It's important to find time to rest and to take a step back and to recharge, um, and to find opportunities for the self. Okay, it's okay if the house is not so clean. It's okay if things right now bili lang tayo ng bili at hindi tayo niluto. It's okay if your output is not, A level. Don't feel guilty. Do not judge yourself. Right now, where we are in this place of vulnerability, uncertainty, and challenges, we need all the more to take care of our mental health, take care of our emotional and psychological well being. Um, in order for us to continue, in order for us to survive and also to thrive, even in these challenging times.
All right, okay. Yeah, and I'm confident that a lot of our viewers can definitely take a thing or two from your knowledge in today's session. We'd also like to remind you that some of the things mentioned earlier might not be applicable to all kinds of patients, guys. So it's best to consult your specialist. Before we end, we'd also like to invite everyone to register on I Am Patient by going to www.iampatient.ph. Thank you. And thank you once again, Dr. Fernandez. Once again, this is J3 Yao, your host for this month's Ask a Doctor episode. Book your appointments through I Am Patient. No more waiting.